her points out, and the other lady. And then you have an hour. If there is time left, I would appreciate it, and I think it would be to your benefit and to the benefit of the Department of Health and certainly the people of New York if I were allowed to talk about my experience.
Okay, why don't you tell me your first name?
Dorothy.
Okay, Dorothy. And who else is on the line that doesn't want to give their last name?
I'll give my last name. My first name is Mary Ann, 2 words without an E, and an H-E-N-N-E-N.
I'm sorry, Mary Ann without an E?
Yes.
And what was the last
name? Without an E.
Sorry?
2 words without an E.
And what was your last name?
Hennon, H-E-N-N-E-N.
Okay. Anybody else on the line?
Yeah.
3.
Okay.
Yeah, my name is Augusto, A-U-G-U-S-T-O.
I can't hear you.
Sorry, it's Augusto. I have a bad line here. I can barely hear you too.
Okay, well, we'll speak up if you speak up. What's your first name?
Sure. It's just Augusto, A-U-G-U-S-T-O, Augusto.
And you don't want to give us your last name?
No, I cannot. No, I have an ongoing case.
And what? And
you have mine, Marie Pascal.
I think I got that already.
Marjorie.
Marjorie? Are you going to give us your last name, Marjorie?
I think I did.
Oh, Marjorie Deutsch. Well, I'm asking people who haven't identified themselves yet.
As I said, I already identified myself with my first name, and I am going to be quiet until everybody who has identified themselves with their last name has said what they want. And if there is some time left over, and you are interested...
because we're wasting time here.
Okay.
We can call her later, Dottie.
Okay, no, we're not going to... Look, I've gotten the names of 8 people, but I heard that there were 11 people on the line.
Some people, I believe, are just listening and don't want to identify themselves at this time for their own personal reasons. One of the big problems is the confidentiality problem that most people do not go public due to concerns one way or the other. We are fighting against multi-billion-dollar industries, the pharmaceutical industry, the medical mafia, the state legislature. So a lot of people have concerns as individuals that they will be retaliated against, and that includes doctors. And what I discovered in the 8 years that I've been working on this is that there are laws in place, but yet we can't find the government agencies to enforce the laws that we have. An example is endangering the welfare of a vulnerable elderly person. There is New York state law. This was enacted in the year 1998. It's Chapter 381, Section 260.25, S2 of the Penal Law was amended to read endangering the welfare of an incompetent or physically disabled person, and that also includes a vulnerable elderly person. And that goes from a misdemeanor to a felony. But yet when I put in a complaint, several complaints with the New York State Department of Health, which is a New York State agency, your salaries are being paid by taxpayer money. The New York State Department of Health refuses to do a competent investigation, refuses to network with the other government agencies, the local district attorneys, so we can press criminal charges for fraud and abuse. So that's been my experience, and I do have everything documented. I don't know if anybody wants to add to that. I believe we all have similar problems.
Yes, definitely. And there's certainly problems with when you do finally get, if you can get to court and then finally proceed with the court procedures. Again, Marilyn is right. They don't follow. They don't listen. They ignore evidence by the Department of Health. And
this is in a civil case. This is in a civil case where a lawyer will not take it on contingency because of the inhumane wrongful death law. So if you're willing to pay a lawyer, they may go through the motions and file papers for you. You may get some kind of settlement that comes with a gag order, which isn't justice. But there is no criminal prosecution in my experience. And also our prima facie case, once we finally did get the New York State Department of Health to cite the first hospital, I have it documented from New York State that the treatment was substandard. The verdict is already in. Why do I have to try and fight my way through the civil court where we lost, where we got shut down at every step of the way?
Yeah, well, let me add to that, Connie.
The problem you're facing with that is that there's a different standard of proof in every setting, and here we have the lowest standard of proof, and we just have to know that something is more likely than not. And then when you go to a civil trial, you have a heavier standard of proof, and in a criminal trial, you have a very, very heavy burden of proof because you have to prove something beyond a reasonable doubt, and you have to show much greater intent on the part of the wrongdoer.
Yes, well, the problem is that I have the proof, I have the medical records, I have the multiple billing statements, I have all the evidence, and the evidence is ignored.
Right. May I just read a passage from the General Public Health Law 10.1 and 2, where it says, cases shall at all times be regarded as in their nature judicial and shall be treated as prima facie, just and legal. And it goes on to say investigations, proceedings, actions related to the enforcement of this chapter, the sanitary code, or any other health regulation shall be presumptive evidence of the facts so stated therein.
What are you reading from, Connie?
From the Public Health Law.
What section?
10, Part 1 and 2.
Subsection 1 and 2?
Subsection 1 and 2, yes.
Section 10, subsection 1 and 2?
Right. And again, it says, shall be treated as prima facie, just and legal. Well, the courts ignore that. And that should not be ignored. I mean, that is, if that's already been proven prima facie, why are the courts ignoring that?
Because what's prima facie in one setting is not going to necessarily apply to another. So let me just look at this.
As far as I knew, prima facie is prima facie. What, you know, you can't shade that one way or the other. If it's prima facie, it's prima facie.
I wanted to say that when an elderly patient who trusts their lives to a doctor in the hospital is kept hostage and not allowed out, and kept hostage and threatened with guardianship, and threatened with having their house and assets taken, allowed to go down to 83 pounds, and kept and given, allowed to get bed sores, and when you have obvious horrendous treatment, and lawyers say that the life of an elderly person doesn't matter, and courts aren't interested, and you have a medical healthcare system that couldn't care less. This is criminal. This is
of course it's criminal.
And I wrote a declaration. I don't know if when I kind of made a statement because I was touched by the healthcare system and had both my parents killed by it. So when there's time, I would like to read what I wrote. Because actually, when you destroy people, you not only destroy the people who are in the hospital, but you destroy the lives of the family.
Well, I would like to ask, yes, absolutely, you destroy the whole family. I'd like to ask Ms. Khan, what is considered criminal by the New York State Department of Health? If you have substandard treatment causing personal injury and multiple billing claims, what is the standard for criminality according to the New York State Department of Health?
Well, the only standard for criminality is what's in the penal law. I mean, the New York State Department of Health doesn't have its own views on what the standard for criminality is. If something violates the criminal law, it's criminal. That's the only standard in the state of New York for criminality.
Now, if the Department of Health is conducting an investigation and they see evidence of criminality, is there any system in place for them to network with the local law enforcement, to the local attorneys?
We would refer it to the local law enforcement if we saw something that we thought arose to criminality.
Now, would you consider multiple billing claims, an anesthesiologist who tries to get paid for anesthesia and medical care and medical diagnostic tests and primary surgery? If he's submitting claims for work he did not do, that's insurance fraud, would that be considered criminal?
Yes.
Okay, so I have the billing claims. I have 10 billing claims of this one anesthesiologist who tried to make money every which way he could, and he screwed up the anesthesia and caused personal injury, and yet my local chapter of the State Department of Health refused to investigate, and I do have the paper trail.
Did you go to the Attorney General?
Yes, and what the Attorney General, yes, I went to every government agency.